I'm Terry Citron, and I'm your trainer today to talk about reasonable suspicion. How many of you are excited to be here? Yay! How many of you have been through training like this before? Most of you, yeah. So a lot of the things I'm going to talk about may be just reminding you about things. Some of the laws have changed, and sometimes questions come up that you're just not sure about. Well, what we're going to be doing is we are going to be talking about the regulations. As you know, you all are covered under PHMSA, the Pipeline Motor, I had this name down. You call it PUMSA? PHMSA, okay. And the fact is that the regulations are pretty much the same for all of these different agencies, but they have some things that are quirky. Basically, the ratio of people that you have to test is the primary thing that is different. Why do you think that we have this program? What is it that you think is the goal of this? And testing and all that good stuff. Yep, pretty much. There you go. Well, the thing is this, that nobody wants to be responsible for hurting someone else. And if somebody has an accident, it can hurt them, it can hurt other people, it can impact your company because of the PR. And one of the things we know is that when they started doing the testing in the 1980s, what they saw was the positive responses to drugs and alcohol went way down. And so we're going to look at that in a minute. The main thing is, like I said, we want to make sure people are able to focus on what they're doing and are doing a good job. So this is what I was talking about, the positivity report. In the 80s and 90s, was the percent of people that were positive was pretty high. It went down. Unfortunately, it's been going back up the last couple years. Any idea why you think it may have started moving up again?
Legalization of marijuana?
Yep. Yeah. There's also been an increase in cocaine, but legalization of marijuana is one of those things that even if you're in a state that has legalized it, even if you have a medical release, you still can't be using that stuff, one, if your policy says you can't, and number two, if you're in a safety-sensitive position. And so it's really helpful to understand that even though they've dropped, they've started inching back up again. So these are the different categories for drug and alcohol testing for the testing. And so what we know is we have to do it when property damage has occurred, when somebody's been hurt or cited, when there's been an accident. It may also be, one, it's pre-employment because we want to make sure we're not hiring people that have those substances in them. Random is part of that group where you're having to pull names every quarter and then having people go and get tested. For cause or suspicion, reasonable suspicion, we're going to talk a lot about that a little bit later. That is a big one, as well as then post-accident is very important. Return to work is going to be after they have been off, especially for something like this, or it could be after they've been off for a medical issue, because if they were prescribed opiates, then that can become an issue when they return to work. And follow-up testing. So if you have done a referral to the EAP to do the SAP assessment, then usually the SAP is going to provide you guidelines on what they recommend for follow-up. And you can follow those or not, but you always are going to want to, for anyone that was positive, you're going to want to do the follow-up. So as you can see, for pipeline and hazardous materials, you are expected to do a drug testing of 25% of your people per year. And that is a random poll. Even if you have somebody who is on follow-up or it has just had it for cause, their name is going to be in the same pool as everybody else's. If you have somebody that was pulled in March, their name can be pulled again when the other pools exist, so that it's fair. Unfortunately, some people may have to be drug tested more than once, but the bottom line is that it puts everybody in the same box. What do you think would happen if that didn't happen? Let's say somebody got tested in March. What can happen if you don't put their name back? No reason to stay sober now, because they know that they're not going to be tested. So the reason that it is this way is to make sure that people are staying with the actual expectation of staying drug and alcohol free. So if an employee is scheduled to do a random test, but then all of a sudden has a family emergency and they leave before completing the test, but yet the next day they complete the test with negative results, what are the consequences for this? Pardon? Considered it positive, correct. Yeah. It's considered a failed test. So because they chose not to do it that day, it is now considered a failed test. And then you have to go through all that process, unfortunately. The clearinghouse came about, as you can see, it was enacted in 2020. And how many of you have are all of you aware, any of you not aware of the clearinghouse? Let's put it that way. Okay. The clearinghouse's purpose is to have documented in one place all those folks who have been found to have a positive DOT, a positive drug screen, and have had to go through that process. The reason is that what used to happen is a truck driver would get in trouble at, say, CoServ, so then they would just leave and go to another company, but the other company had no information that person was in the DOT process. So they would just start again. And it was noted that people were doing this all the time. Whenever they'd get tested and be positive, they'd be like, okay, I'll just find another job while they're off doing the SAP things. Because of the clearinghouse, what it makes people do is if somebody gets positive here and they try to go somewhere else, it's already going to be in the system. So anyone that tries to hire that person is going to already know that they are in that process. The person's going to still have to stay with the same SAP assessment and the same evaluation and recommendations. So even if they don't stay, it tries to ensure that the people that you hire are clean and sober. As you know, drug tests right now are urine analysis and the evidence-based breath test. They are working on including a mouth swab, which I thought was very interesting, because that would be a whole lot less easy to fake. And they're always worried, of course, with urine drug screens, there's all those regulations about how people get the sample and how it's observed and things like that. When the drug tests are done, they don't check for everything under the sun. There's a lot of things that they don't cover, but these are the ones they do. They cover amphetamines, marijuana, cocaine, heroin and opiates, PCP, alcohol, and ecstasy. And as you said earlier, one of the most popular drug that is still found is marijuana. One thing that's interesting here is that you can see where are the positivity rates coming from. And so when it was for cause, that is the highest level of people who come up with a positive test. It's still only looks like about 13%, but if you're having a concern, it very likely is that it is reasonable. The post-accident, their positivity rates are fairly consistent, as you can see. And then you see the pre-employment, which is lower, and then the randoms are even lower. So that's the good news, that hopefully when people are being referred, they're being... One of the things we did see, or we thought that could have been an issue is, like in 2020, when everything got shut down, some people started using more drugs and alcohol because of coping with the isolation and the issues with employment, things like that. So these are the kind of signs and symptoms that you are wanting to watch for. And you know your people, hopefully fairly well. So it's important that you be observant about when is this the same and when is this different. When we see somebody that's on coke or amphetamines or PCP, they're going to be hyperactive. They may be agitated, they get irritable real quickly. They may also be depressed, be tired, and have suicidal ideation. It just depends on where they are in that cycle of using. Depressants, which includes alcohol, marijuana, and heroin, definitely tends to slow their responses. They tend to be tired, they don't care as much anymore, and they can lose their temper and be agitated. So some of the things are alike and some are different, depending on how they metabolize that medication or that drug. One of the things that we like to talk about is where is somebody in the stage of addiction? And this is the thing, you are not the person who has to figure out where in this level is one of your employees. Y'all are not diagnosticians, it's not expected of you. The reason we talk about it is because it can give you an idea of where people may be and then be able to recognize, they're really this is really a problem we have to tend to. So in the first stage, they may be using to deal with stress or because their friends are using it. They may be starting to think about their next use. They may be tardy, productivity may be down, they're calling in sick on Mondays. They talk about it. They may also be starting to have family and relationship issues. In the middle stage, people are starting to use now because of relief. It's like, oh, I had a bad day, can't wait to have whatever. They may start sneaking, so they hide it, they put it in something different, they try to pass it off, and they are very good at rationalization. Even the rationalization can be earlier as well as later, but the rationalization means everybody's doing it. It's okay, I'm not at work right now. I've been using long enough, I know I can handle it. Those rationalizations are things to be aware of because that means that they are aware that there's a problem or they're denying that they have a problem and want you to buy that. But by the middle stage, your folks may be having more problems with productivity and absenteeism, they may be communicating, they may be going through legal problems, as well as physical issues. We know there's a lot of physical issues people can have, whether it's from alcohol or drugs, and it may show itself. In the late stages, that's when you're seeing people who are probably more likely to be using at work because they can't stay off. They have an urgent need. They just want to not feel like this anymore. Such and such made me mad, I'm stressed, I'm gonna use, whatever. And they don't really feel like they have control of it anymore. They're being controlled by the substance, not them controlling the substance anymore. In workplace, they're generally going to deny everything. They're gonna justify themselves. But at that stage, most likely their job is in jeopardy. Everything suffers. They may be losing their family members. Everything kind of falls apart. Any questions about any of that? If y'all have questions as I'm talking, please let me know. I don't like to hear myself talk too much. So what is the BAC, the blood alcohol concentration limit for operating a vehicle in Texas? Yes, thank you. What is the BAC limit for a DOT violation? 0.04, right? And what is the limit that you are held to as a CDL holder if you're operating a non-commercial vehicle on your own time? Pardon?
It reverts back to 08.
Correct.
You're in a non-DOT role.
Correct. Yeah. If your limit is between 0.04 and 0.02. You may still have to have them leave the business, leave work, but they can come back the next day. It does not mean, if it's below 0.4, it doesn't mean that you can just let them work, again, if it's over that 0.02 mark. Alcohol is one of those things that people tend to abuse a lot. And the fact is the problem with alcohol is it's legal, and a lot of people drink, and they enjoy it. The problem is when they are doing it so that it's affecting their job, or it's affecting their body, or their relationships. That's when we know that there is a dependence or an addiction as opposed to just a casual use. But when people have alcohol in their system, they may be depressed. Mentally, their processes are dulled. They aren't as coordinated. You might smell alcohol on their breath or even through their sweat. They may be sleepy. Their reactions are slowed. And of course, if you're driving things, if you're moving things that are very sensitive, which I know happens all the time, if you have a slow reaction rate, that's not good, because you need to be able to react very quickly. And speech can be slurred. So as far as in your workplace, these are the things that you may be seeing, is that they may not be as productive. They may not be concentrating very well. They are late, sick leave, putting their workload off on other people. And they don't deal with workplace issues as much. They may try to hide them. And one of the things that can happen, what I've seen is, well, everybody knows Joe, right? Joe, yeah, that's just Joe. He smells like that every day he comes in, but that's just Joe. And we know Joe, right? Joe's a great guy. And or this is Jim, and Jim's going through a hard time, right? His wife is going to leave him. I don't know why, but she's, all this drama at home. So of course, we want to let that slide. No, you don't. Pardon? Pardon?
Oh, we have a joke. That's a joke.
Oh, I'm sorry, Joe.
I was just letting him know we're not letting him slide anymore.
Oh, okay. I'm sorry. That's just the name I always use. But if this does apply to you, Joe, then you can let us know. Again, sometimes people think that they're being responsible versus abusing it. But when people start having blackouts, that is a sign that they're over-abusing. It could be that they're having issues with friends and family. One of the questions we ask people when we are assessing is, have you ever been bothered by family and friends concerned about your drinking or your drug use? It sounds like a very minor question, but generally they're going to be the ones that see it first. And so, yeah, sometimes, my wife's always telling me to quit drinking, but I'm just relaxing. They may have health problems. So you may be seeing people who are having liver issues or even cardiac issues, all sorts of issues, because it also depends on what substance they're using. They may be getting involved with the legal system. You would not be surprised how many people I spoke to who, it's the only time I ever drank that much. Usually it's not. Usually it means it's the first time they got caught when they get a DWI. So cannabis, marijuana, is one of those drugs that has changed a lot over the years. But typically you're going to see people either using eye drops, they may have red eyes, they may have slowed speech because they're just kind of in that fatigue state. You may smell it on their clothes. They don't care. And they're tired, less motivated, and they may have a cough or a sore throat all the time. So the thing with marijuana is, again, it slows their reaction time. We don't want them to be slow. We want them to be on target when they react to things. It can distort their vision and perception. What can you imagine happens when your vision or perception is altered? What can happen in the field? running into stuff. Yeah. I thought I had enough room, but I didn't. And that post just jumped in front of me. I have no idea how that happened. They may have poor decision making or poor judgment about things. And they can't really, again, judge time and distance very well. One of the reasons, as most of you know, marijuana stays in your system for at least 28 days. It is a fat-soluble drug, which means it's attached itself to your fat cells. People who have been consistently smoking a long time, and it is going to be longer than 28 days, most likely, before they have a negative drug test. And it's just because they have more of it still in their body. You know, it used to be when, you know, I'm probably older than all you, but the thing is that in the old days, in the 70s, 80s, even 90s probably, it says that if you smoke 3 to 5 joints in an entire week, that is equal to smoking 15 to 50 joints back in 1978. That's a huge difference. The growers have really come a long way of making their stuff stronger, better, more addictive, more impact. And so if you think, well, I smoked in college or I smoked when I was whatever, it's not the same old marijuana that you're seeing. When they combine it with alcohol or other drugs, then it can multiply the effect. One of the things I hear sometimes is like, well, I was in a room of people I was hanging out with my friends at a party and they smoked, but I didn't smoke. It must have been passive inhalation. Oh my, I didn't do it. So Johns Hopkins did this study, and I really like it because they took 6 smokers, 6 non-smokers, and they tested them twice. So they tested them in a room that was ventilated, and then they tested them in a room that was not ventilated. What do you think was the results to see if they had THC in their system? It was negative for the people in the ventilated room. The people who were in an unventilated room could sometimes get a little bit of high. They could sometimes get a low level in their body. But none of the people in the ventilated room had any signs or symptoms or tested positive. As we know, the marijuana laws are different. Texas is a little behind. Let me see. What we know is that Texas has some laws that will protect people on medical marijuana if they have a list, have a card, and we're going to talk about what they are. And other than that, they have no tolerance. And in fact, Texas is still arresting people for it, whereas some of the other states have stopped arresting people for it, or they've made it okay. It used to be that legislation was very against medical marijuana. Then, unfortunately, it's gone back and forth. Again, that's by state with some of it. And so it could be that you have somebody that's in a non-sensitive position that is using it for a medical reason. In your company, Paula, what is the expectation for non-DOT people? So zero tolerance with everybody. Because some companies are making it so people who are not covered by DOT can get away with it, but if they're in a safety sense. But for your company, it's zero tolerance. One of the things I've seen is a lot of people are using CBD oil, or they're using something called Delta 8 that they use to help them sleep, etc. The problem is that they think this is just hemp and it is not going to show up, but it will. Every once in a while, there are providers who do make sure that the THC is too low, so it cannot get you high, but has the effects that are wanted. But I know I had to work with one man who, he said, I always check it. And then while we were on the phone, he went and he checked the percentage of the last batch, and it was too high. And so now he had to go through the SAP process, and he was laid off, or he put off work until he was cleared. It's never allowed for people who are in safety sensitive. So any amount at all in the system is a problem. Nobody provides protections yet for recreational use, and especially if people are found using during the job, that can be very, very critical. These are some of the qualifying conditions that may get someone a medical marijuana license. And again, you can see there's a whole lot of them. And a lot of people who think, oh, well, I need a medical card, I'll just pretend and get the doctor to justify it with this diagnosis. But as we said, for your people, medical marijuana is not something legal. If they get caught with it, they get caught with it, and they have to have the consequences. Opiates is the next big thing. When we've started seeing all these drugs, oxycodone, hydrocodone, codeine, morphine, all of those things that are made for pain, most of the pain relievers have opiates in them. And it can be, maybe that it started legally because they had an injury or whatever, but then it becomes where they really don't need it anymore. Or they're using it to deal with other kind of pain, emotional pain, rather than the physical pain that they're under. One of the things that we know that can be really hard for people who try to get off opiates is that they can have, in day 3 to 5 is when they have bone pain. And it's very painful. So now they're having this bone pain and they don't realize it's from withdrawal. It is not because their problem has come back. And so that's one of the reasons why opiates are really hard to help people kick, because they think that they can do it, and then the bone pain, which is a standard thing that happens, kicks them in the behind. Again, sometimes people, one of the things that we know is that we're seeing a lot of overdoses, particularly fentanyl has become a very scary drug for America, because people are using it, they're using patches, they're using the pills, they may be stealing them from their family members who actually need those things, or they may be getting them on the street, or they may have been prescribed. Again, we have doctors out there who unfortunately are not very moral, and they just give people what they want, and then of course now you have a problem. The good thing is naloxone, can be, if given properly, can reverse an opiate overdose. That is actually something that you do not have a prescription for anymore. You can get it. A lot of workplaces are having that on site so that should something occur, you can give that drug to them. The good thing is there's no bad side effects. Let's say it wasn't an opiate overdose and you gave them the naloxone. It's not going to have any negative effects on them. With opiates, you're going to see mood swings. Again, they're not very alert. You see those constricted eye pupils, and they may be vomiting, they may be constipated. Especially opiates are very good at constipating people, unfortunately, but it can also affect their respiration. When they're driving, they're daydreaming. They may not be focused on what they're doing. They're just daydreaming, they're not focused. They have distorted vision, so they have trouble with judging distance as well as a sense of time. So it's something that's very important to recognize. Amphetamines, these are on the increase, unfortunately, especially meth is evidently all over the place. People just make it in their homes, and they've tried to make it much harder for meth dealers to get their supply. However, it's still happening, unfortunately, and we're seeing that it is very addictive. With amphetamines, you're going to typically see them as restless, agitated, again, the dilated pupils. They may be having an increased heart rate or blood pressure, so they may feel like their heart's beating out of their chest, whatever. They may be sweating profusely. Again, now I know this is Texas, right? If you walk outside, you're going to sweat, okay? But it's a matter of, in the conditions that you're seeing this person, is it a reason that they should be sweating right now? Is it something that's normal for them, or is it not? People who are in that state take more risks. They're like, oh, I can make this light. No, I can't. They may overreact, so they may overbrake. They may over-accelerate. They may be oversteering, whatever it is. Their reactions, again, are very, very expanded now. So they think they have more control than they do. Do y'all have any questions about any of this? No? Okay. With meth, one of the reasons that meth is so dangerous is that it kicks in about 5 to 30 minutes, and then the high lasts for anywhere from 4 to 16 hours. But the drug is still in their system when they start crashing and going down. So what people will often do is then they take more. And so what's happening is they're now binging because they're chasing that high. And so they are continuing to use. And binges can last 3 to 15 days. After that, they're probably just so exhausted that they're unable to function anymore or like, give me help. But it's something that you have to watch for, especially when people have been gone, things like this. Are you seeing any of those signs and symptoms? Cocaine, as I said, it's on the upsweep, unfortunately. With that, again, people are having trouble with their sight. They're having trouble with their coordination and concentration. They may be wet. Sometimes what happens is they feel like there's bugs on their skin or under their skin, and there's not. That's a very scary thing for them. They may hallucinate or be really overexcited or overreacting to stimulus. They may not be able to sleep because cocaine tends to keep people awake. But they can become, again, that sweating. They may be super talkative and super happy sometimes. But the problems are when they're driving or when they're working with safety-sensitive equipment, they have a slowed reaction time. Again, you don't want to react too quickly or too slowly when you have a situation. Of course, it all depends on what you're doing, whether you're in a vehicle or whether you're dealing with like the pipeline, those kind of things. People don't have good judgment, and they don't correctly measure time and distance. PCP, we don't see that as much, but again, you're going to see an increased breathing rate, sweating. They may have numbness in their feet and hands. They may not be very, very coordinated. They may be vomiting, drooling, dizzy, all of those nice fun things. And they may have hallucinations again with PCP. And their speech may be very garbled or very brief, not able to answer in full sentences, things like that. Again, as you can see, the effects on driving are their perception is distorted. They may see things that cause erratic driving. So if I think there's a deer in front of my vehicle and there isn't, I'm still going to react because I see something that isn't there. It can have sedative effects. And the good thing is that it prevents users from feeling pain, but it comes back when they stop the drugs. And so that's why we need people not to be doing this. Ecstasy is another one of those drugs that don't see very much of ecstasy. People call it X. But they have a raised pulse and temperature. They may be nauseous. They may be just a hugger. All of a sudden, they just want to hug everybody, and they're so excited to see you. And they are like a big old teddy bear all of a sudden. But they may also be grinding their teeth or jaw, clenching. There are people who do this, and so they get adult pacifiers, because the adult pacifier evidently helps them with that jaw clenching and teeth grinding. But I looked it up last night, and it said that there are people who use those for anxiety. They don't know if it's true or not, if it works, but they think that, so just because someone has a pacifier doesn't necessarily mean they're doing it for this reason.
No, there's still something wrong.
Well, that's true. It just may not be something that will show up in a DOT test, right? Thank you. So what are your responsibilities? Are you supposed to police everybody as they walk in the door? Check their eyes? Your responsibility as a supervisor is to maintain a safe and secure environment that is protective of your employees and of the work. Your job is to evaluate and discuss performance with your employees. You're supposed to treat all employees fairly. And when you're talking with them, you also need to make sure that you're not demeaning people, you're not labeling people. For you to just walk up and say to somebody, oh, you're a drug addict, that's a label. You may not get very far with that conversation. It's not your responsibility to diagnose the drug and alcohol problems or to have all the answers. It's not your job to provide counseling. It's not your job to be a police officer. Have any of y'all felt like that, like you're being a police officer or you're having to figure out all the answers? For some people, confronting an employee is super hard. But what can happen is if you're in that position where it's, oh, that's just good old Terry, and that's just what Terry, Terry's having a hard time, so I want to ignore and not look at what their behavior is. But the problem is you are not helping that person because they will continue to use as long as they can get away with it. And one thing I saw was I dealt with a workplace that had several people who had been in trouble and it was known they had trouble, but were never sent for a mandatory referral because they were just good old boys. And when they got the good old boys out of there, the whole idea about keeping people on track, being productive, et cetera, that changed. And so now they're having to deal with all of these problems because the people before them just ignored them. So is it enough information for you to accuse somebody that has alcohol in their breath if they're DOT?
It's enough to make you ask more questions and investigate it, but not necessarily accuse them like you said.
Yes. What were you going to say?
I said, don't ever accuse. Have conversations, but don't accuse.
Yep.
I
There
know
you go.
hand sanitizer has thrown me off a lot of times when people come into my office
In what way?
because it smells like alcohol.
Good point. Yeah. So you have to examine it more. You need to get more data. You want to make sure that you are including your human resource people. Another resource you have is the EAP. You have a team that is there specifically for management consultation and support. They are well trained and they can help advise you about how to deal with something or when is it time to have that intervention or what are you going to do if that's something that you need. But your HR people are one of the first people that need to know that you have a concern. And that would be before you confront them or before you have that discussion possibly, depending on what's going on. Some of the traps that supervisors have are that sympathy. Again, they feel so sorry for Terry because, they had a death last month, and it's a reason that I can understand why they're using. Or they give you a lot of excuses, and you may think, oh, well, maybe that's true, and et cetera, but it still doesn't make it acceptable, and that's the problem. They may apologize to you. They're, oh, I'm so sorry. Please don't send me. I promise I'll never do it. Please. Have any of y'all ever had any employees do that with you? I hear some nods. Yeah. They may try to do diversion. So they may blame you. They may say you are overreacting. I am not using, whatever. They may say, well, I knew you when you were in this job, and I know you did it. And that makes it really hard to deal with. They're just innocent. They just don't want to think that these people that they care about, I mean, you become kind of like a work family, right? And nobody wants to think that that person has a problem. So they try to put the blinders on, but it doesn't work. Some people, they may come at you very angry. They may want your pity, and they may cry. One of the things that you want to do when you do have that conversation is you want to have at least one other person in the room. If it's not HR, then it's someone else, but you always want to have someone else in the room, because when they start pulling these traps, hopefully between the two of you, y'all will stay with the facts, focus on these are the facts of what we're seeing, and this is why we need to go through this process. Any questions or thoughts about that? Are they pretty good about including you when those kind of things happen? Yeah, good. Awesome. That's what we want. We want you to trust HR and that they are going to be there to support you, and they can help walk you through before you have to have that difficult conversation. So how about this one? A hash pipe falls out of the coat pocket for one of your DOT covered people. Is that enough information to make reasonable suspicion determinate? Was that yes? Any other opinions? You know, hash pipes are illegal to purchase. So that's one of the problems, is it may or may not be illegal. However, do you have a policy of zero paraphernalia on campus or at work? Not sure. So if you don't have a policy that says you can't have hash pipes at work, then now you have to go further and be doing a lot more investigating, but you can't use it by itself as the reason to go to reasonable cause. One of the things you want to do, though, is you want to observe them. Let's say they're able to give you a good reason, and you want to at least observe those folks for about 30 minutes. Make eyesight, so that you're making sure that this person is coordinated, is making good decisions, is on target, etc. Sometimes that's hard, I know, but when it comes to for cause testing, in a way it's a judgment call, but what you want to do is you want to completely base it on facts. This form is super important. And one of the things you want to do is whenever you have a suspicion or concern, you want to go to this form and you want to identify what objectively are you seeing. Did you want one? There you go. What are you seeing? Are you seeing somebody who is stumbling or has difficult gait? Are they overly lethargic? Is this different than every other day that you've seen this guy at work? So if they are always tired in the morning, it may be that, but it's still something you have to include. You want to make sure that you're being very, very clear about what you observe, and that includes their speech. Are they slurring their words? Are they not willing to make eye contact with you? What is going on with this person, and do they fit in here? Are you having a bunch of the blanks that you have to check off, or even a few that fit really well? It's the more objective that you can make your evaluation and present those facts to the employee, the better you are. Because if you focus on the emotion or being insulted that they would do this to you, you're going to get lost, and you're not going to be effective in making that conversation. You want to make sure that you have your facts in front of you, because especially when they start pulling on that sympathy card, or trying to divert you or get angry, you can still come back and say, yes, but this is what I'm seeing from you. and we believe there is cause to go ahead and have you tested for cause. Any thoughts about that? How many of you have ever had to fill out one of these forms or contact the EAP for a DOT evaluation? Nobody? Well, hopefully that means that y'all are a great drug-free company, and that's great. That's what we want. But it's also important that if you are seeing these kinds of signs and symptoms, that you don't blow it off. Don't say, well, that's just Terry. That's, you need to be very, very observant and focused on all of this stuff. So if an employee presents with body odor, disheveled clothes, acts distracted and defensive, do you have enough to make a reasonable suspicion allegation? No. What do you need? Why is it that you would say no? You're correct, but.
It could just be bad hygiene.
Yeah, exactly. It could be somebody who comes in like this all the time. Or they just came in on a flight last night and came to work anyway, and they're just exhausted and they haven't changed for 2 days. If this is one of those things where it's very important that you know your people. You see Terry every day, and Terry is always immaculate and dressed, but now they are not, and they look like they've slept in their clothes for 3 days. It means that a conversation needs to be had. It may not be that they're on drugs. It may be that they are just having problems at home, struggling with depression, those kind of things. So there's a 6-step process. And this is one of those things. I'm going to kind of go through my notes with you about it. I hate it when paper doesn't cooperate. So the first thing that you have to do is you have to recognize it. Are you recognizing symptoms that may fit on this form? Are you recognizing something is going on that doesn't seem correct? After you recognize it, you want to, again, be very, very clear about what are the signs and symptoms that you're seeing. Then the next thing is you got to document your observations. Be very objective if you can. And I know that that's hard when you've worked with somebody for 20 years. It can be difficult. They may be your friends. But the problem is that's when you have to pull back and be objective and talk with other people, get other people involved in that conversation. Using the checklist can help you stay on focus with that. You want to make sure to consult the appropriate people. Human resources is your first stop. But you also have the MCS team at the EAP. So with the MCS team, you can call them and tell them what you're seeing and ask what they think. They can help work with you on that. If you have concerns, as you know, you can make a formal referral. It doesn't have to be a formal referral due to a failed drug test. It can be you're making a referral because of job performance, things like that. You can also refer them in a non-mandatory way, which means that you're recommending that they go, but you're not going to get any feedback on it. After you're going to consult, then you have to develop an action plan. Are you going to put this person on leave? Are you going to refer them for a drug test? Are you going to remove them from their safety-sensitive positions while this is going on? You're also then going to contact your EAP. And it's recommended that you contact the EAP before you have that conversation, because then they are ready and they know what your concerns are, so that when the guy calls in and says, I have no idea why I'm calling you, I was told to call you, and so I'm here. And then the person on the other line can only go based on what they tell them. If you call the EAP first, they have what your concerns are. They know what you're calling about, and say, well, you know, I understand that you missed work for 3 days, and then you came back very disheveled, and that you smelled like alcohol. Is that true? They can question them because they've got your information. Next, you want to meet with the person, and again, you want to focus on your factual observations, what your policies and procedures are, as well as what DOT policies and procedures are. And you want to make your expectations very clear for that employee. My expectation is you're going to leave here, we're going to take you to get a drug test, and then we're going to have you go home until we have those results and make a decision. Or if you think that they're not impaired, we're going to do a drug test, or we're not doing a drug test, but we're going to take other steps. Generally, if you've got that concern, then it's worthwhile to possibly send them for a drug test. Keep in mind, 80% of the people that are sent for cause still don't come up positive. But by doing it, anytime those issues come up, nobody can accuse you of, oh, you're just picking on me, or you don't like me for one reason or another. So you have to be very, very fair about this. Everybody is across the board. But when they come back, you also need to support them and supervise them. And sometimes that can be hard, especially if you are angry with them for putting you in this position, but that's part of your job. What are your thoughts about all this? Paula, what kind of situations have you seen are most difficult for your supervisors?
I mean, just having those conversations, like you said, you work with somebody every day, 8 hours a day at least or more, and you kind of develop relationships. So it's hard, but in the same sense, with being able to help people with medical problems instead of really substance abuse. So that's another layer.
That's great. Yeah. Could all of you hear what she said? You know, that she said it helps possibly identify that there's medical issues going on or other issues. And we know the hard conversations are hard, right? That's why they're called hard conversations. However, one of the things that can happen is you see the signs and symptoms and don't take action. Now they continue their use. And even if it doesn't affect work, it can be destroying their family. Or they can drive into a pole or have an accident and kill somebody. So you don't want that on your conscience. If you are seeing something, you got to say something, just like they say on the airport. If you see something, say something. With reasonable suspicion, you need to determine, based on specific, current, and articulatable symptoms. If you don't know, it's like, well, I think they're odd, but I don't know. Well, what's going on? I can't really explain it. Well, that's not going to be good. You need to be able to take the time to be able to articulate what it is you're seeing, what are your concerns. And you can't say, okay, well, I know 10 years ago he had a positive drug test, so he's probably positive again. No, you have to go based on what's happening in front of you right now. What is it can include the pattern that you've seen recently, but you're not going to go back 10 years and say, well, he was a problem back then.
I think one thing to mention as well is that we have a zero tolerance policy here at CoServ. So our policy is a bit more stringent than the DOT policy. So for that return to duty after a positive test, it's our zero tolerance policy comes in first.
Good. And that's when you may have, unfortunately for some people, makes that even harder because they have marijuana in their system, and they're going to be off work for 28 days at least. They can do the home test to see if it's still showing up before they come back. And then when they return to work, do you do a test?
I mean, if they're
Return
positive,
employees, yeah.
they don't come, it's a zero tolerance policy. So if they tested positive or if they had reasonable suspicion that became positive, there is no, it's a zero.
He's not coming back.
Okay, so it's just you're done. But now, do you still refer them to a SAP, or do you still?
It gets reported through the clearinghouse and things of that nature that need to be done. But as far as our workplace policies, it's zero.
Okay. So no wiggle room if they come back positive. Okay. Or if they came positive the first time, is what you're saying? Okay. You want to make sure that you're identifying the folks' appearance, behavior, speech, and body odors. Again, if somebody is just reeking and you know what that smell is, that's something that you need to document. So again, if you have reasonable suspicion, one of the things you need to do is you need to remove them from that safety-sensitive position. Don't send them off to work and then say, okay, well, we'll talk about this later, because now you've got somebody out in the field that is impaired. You're going to alert your HR team, and then you're going to discuss those observations that you have for them. You're going to arrange a for-cause alcohol and drug treatment, drug testing. If you are sending somebody because you believe they are currently on something, you either need to drive that person or have someone else drive them. Why is that so? Yeah. If you send them out and then they have an accident because you knew, you could sense and you believed that they were under the influence, now it's on you. You didn't protect the public by driving that guy over there. Again, one of the things you want to do is encourage the employee to follow through with the EAP. So even if they are being fired, they still have the benefits, and they can still get that emotional support and that referral to treatment if that's what they need, and all of that good stuff. So this one, I guess, doesn't matter, because if they come back.
That was actually the question I just wrote, so what is our policy on that? Because I know post-accident, an employee is allowed to work in a non-safety sensitive role, but is our policy different if it's reasonable suspicion?
No, I mean, if you think that they're positive for some sort of influence of some sort of drug or alcohol, you're not going to release them back to work while they pending a test result.
So on a reasonable suspicion, they're sent home after testing while we pending results.
We wait.
Does that make sense?
That's what I'm,
We wait.
so what if you're sending me for a drug test on reasonable suspicion, I come back negative, but you just sent me home for whatever it took 3 days for results to come back.
How long does it normally
Now, I
take
just
for results
lost
to
out
come
3
back?
days
3 to 5 days.
not being paid
3 to 5 days, okay.
for nothing when I came back negative. You know what I mean?
Yeah, pretty much.
I mean, we may not have a policy on it right now, but really, I don't know if we've ever touched on it.
Should we be back paid for those 3 days?
But it is a good
They'll
question.
make you come in and wait.
Because I wasn't in the wrong for anything.
He was just acting.
Yeah.
Or do you put them in a non-safety sensitive position, or do you just have them not come back until the results come back?
So I think you have to look at each situation differently. If you had a non-DOT position of somebody that's suspected to, reasonable suspicion, you don't test them DOT, so we have rapid drug screens and we have rapid BATs, right?
Right.
So essentially, you would send that person that was non-DOT for a rapid. You get that back same day, go back to whatever you need to do. If you've got somebody in a DOT position, you test them both ways. You got a rapid, but you don't return them back to a DOT position so that they're not on safety-sensitive positions, but they're back to work because they passed their rapid. I think that would probably be my answer to that, but it's not a situation that we've come across yet.
Right. So I'm saying if we ever did, if the person comes back negative on everything, they're kind of,
Stuck in limbo.
yeah.
But I think as long as you remove them from that safety-sensitive position, I don't truly know that that's the answer and that's how we would proceed with that, but we can definitely look into it and see if that would be an option.
Good question. Do you have any other questions that you've been saving?
Because it makes me think of other questions that we can talk about.
Yeah, go ahead and bring them up. If you have the questions, probably other people in the room do too.
Oh, well, no, mine's for other stuff and other policy and how it
Oh.
makes me think of other, we're me and Heather can
Gotcha.
talk about that later.
Not for me, right? I don't have to be in the room for this
Start
one.
stirring in the entire room is what
I get you.
we can talk later about those questions.
Okay. So after a positive test, one of the things another thing you need to do is make very, very sure that you are filling out the correct forms and that you are completing them correctly. It can mess things up if this is a DOT referral and you do it on a non-DOT form, you can have problems. The lab is only going to do it based on non-DOT. They're not going to be doing the DOT tests, and so you need to make sure that you're using the correct form. Sometimes we've heard that the supervisor sent the wrong form, or it was an old form. So please check with HR, make sure that you have the most up-to-date forms before filling it out and sending them for drug testing. Once it comes back positive, you're then referring them to a SAP, substance abuse professional. And what the substance abuse professional is going to do is they're going to do an assessment. They're going to put them through some tests. They're going to talk with them. They're going to get all of their history. And then they're going to make some decisions about what they recommend. For sometimes, it may be they want them to go to AA meetings or NA meetings. It may be that they want them to go to inpatient treatment because their situation requires it. It may mean that they just need education, or it may mean that they need outpatient drug treatment. It all depends on what the SAP says. Now, one of the things that we've seen before is that people, once the person has been assessed, the SAP should be returning to your DER a letter saying, this is what our plan is, this is the history, this is our plan. And then once the person has done and jumped through all the hoops, you get another letter that comes back that says he is cleared. And it also has what their recommendations are for follow-up testing. As far as the return to duty test, again, that's at your discretion, and that's not something I'll do as far as letting people up. But you do want to follow up. If this is a person who is in your employee, make sure that you're testing them. Usual recommendation is about 6 random times in 12 months. So it could be that you test them one day, and then you test them the next day. That's 2. But if you have a suspicion, you want to follow up on that. Anything that is related to this, it's very important, whether this is medical issues, whether this is relationship issues, whether it's drug and alcohol issues. Please respect your employees' privacy. It can cause them a lot of pain, and then they can come back at you because you breached HIPAA and that you breached their information. You only need to communicate with the people who need to know. You can just say, Terry's off for a few days. Why? He's off for a few days. Get back to work. You don't need to answer it. Please protect your paperwork. I worked with one place that they actually put a referral on the bulletin board, where everybody that came through saw it. And it's like, that is horrendous, okay? It's nobody's business if that one person trying to humiliate them by leaving that information on my desk and walking away. You see that on TV where they do that. Don't. You cannot leave this information available to anyone else. Any questions about that? Again, some things you want to make sure you're not covering it up. If you are having to cover up for things, if you're having to pick up the slack or having to get other people to cover for them because they're tired, you need to recognize you have an issue. You do not necessarily discuss their personal problems. You're their boss, you're their supervisor, and as much as you want to be their friend, it may be that you getting into their personal stuff is then going to make you sympathetic and make you excuse things. It makes that temptation really great. And so it's just important that you understand that you don't have to have all the answers in order to refer them for a mandatory referral. You have to go based on the facts. And then let them know that the personal problems they're going through, they can get help for free through the Employee Assistance Program. It's there for them, for anything that may be going on. You don't want to make idle threats. Don't tell them, if you do this again, then I'm going to do this. And then the next time comes, well, I told, next time, I'll let it slip. Don't accept excuses. Focus on the facts that you have. And again, you don't want to let them drive. Typically, in most companies, just so that you know, when the SAP makes the face, since COVID, they made it so that they can do virtual SAP assessments. The regulation, I don't know that it has changed. They're working on changing it back to, or changing it to that they can be still seen virtually, because we have people in the middle of nowhere, and the closest SAP is 250 miles away. And so being able to do the evaluation by virtual is great. But they're going to make the recommendations and strategy. They're then going to send HR or the DER a letter stating that. And most of the time, they're also going to send it also to the EAP, so the EAP knows what's going on. Because then the EAP is going to be checking in with the SAP or in with the employee to see, where are you now? What's going on? Because you are not in a position where you can ask what exactly, well, did you go to your appointment? Did you do this? But with a mandatory referral like this, we can let you know, no, they missed their appointment twice. Because that gives you some information about where they are as far as taking care of themselves. At the end, they're going to send that second evaluation letter again. Now, this is the thing. If you're employed, typically what they are supposed to do is they are supposed to tell you one letter, what they saw, what the person did, and the fact that they can come back to work. And then in a separate letter, they're going to tell you their follow-up recommendations. Reason being is that employee has a right to ask for the letter, but only the first letter. What was the assessment? What was recommended? You never want to give the employee what the follow-up proposal is, because now they know, and they can just be careful. So these are some really good areas, and the DOT.gov has all of the regulations. One of the things I did before coming is there were a lot of areas that I've talked about that were not specifically in the training, but I wanted to understand it in case you asked me questions that I couldn't answer. And going to DOT.com is a great resource. You can just Google it, Google what you're looking for, and then you can get answers about it. Same with datia.org. Do y'all have any questions? Concerns? Have I razzle-dazzled you? Have you taken your breath away? You can't speak. Ask me questions.
Is there any tasks that are ever listed that are, safety sensitive, or is it just say driving a DOT vehicle is what it talks about?
It includes safety sensitive. So
It also depends on your umbrella, right?
Right,
So, like,
it depends on your
gas-
umbrella. So do we decide what safety sensitive tasks are as a company, or is there a true list of safety sensitive tasks?
Well, it depends, right? So your OQs, things that you would do on the gas side, that would be deemed safety sensitive. For the FMCSA vehicles, it's different. Your motor vehicles that you're on big trucks, right? You got your big trucks, that's going to be your safety sensitive functions there.
Right.
CoServ is deemed safety sensitive when you're 30 feet up in a pole.
Right.
That's something we would probably restrict, I would imagine, but that's a company decision. But it's not governed under that DOT umbrella as long as it's not pipeline. So it just depends.
yeah, because in your business you have a lot of positions that aren't safety sensitive unless they fall off their chair for some reason. But other than that, there's a lot of positions in your business that can require safety sensitive interaction. So whether it's hooking up a pipeline, driving a truck, any of those kind of things. I know y'all aren't oil, but the electric. The gas, yeah, the gas. So you have the gas pipelines.
And then we got the gas people that drive big trucks, so then it gets even more convoluted.
So the EAP is probably the most underutilized benefit you all have. The EAP is quiet and confidential. Nobody is, unless you refer somebody under a mandatory referral with a signed release of information, no one is going to know that that person called. No one is going to know what happened or the outcome. Anyone that we refer people to is a master's degree and above therapist. They have stuff they have to do, right? They have to be very objective. They have to be supportive. And they have to keep confidentiality. If it's a non-DOT referral, if it's formal, the only thing you're going to get from those folks, let's say it's not a DOT, it's not a SAP requirement, you will get whether they're being compliant or not compliant. Are they attending their appointments? Are they not? With the counseling is for anything that they may be going through. And I believe they have, is it 6 free sessions? I think so. So you get 6 free sessions of counseling. And understand this, the counseling and all of the services that you have are not only for you, but they're for anyone that lives with you. It's for any children up to the age of 26 who live out of the home. So you do not have to call for other people. You can give them the number and then they can call. And again, you're never going to know that somebody called unless they are an imminent risk of harm to self, imminent risk of harm to someone else, endangerment of a child or an elderly person, or a judge-ordered subpoena. Those are the only times they breach. For some people, they go there because insurance doesn't typically cover family or couples therapy, but your EAP does. You can have individual counseling, you can have group, family. It's not group, but it would have to be somebody you're in a relationship with. They also have legal and financial resources. Now, if you are having legal issues, whether it's you want a will or estate issues, they will help you get a free 30-minute consultation with an attorney. And then if you choose to hire that attorney, you get a 25% discount on the rates. You cannot use the legal services about work, any work. Could be an old employer, doesn't matter. They will never cover anything that's work-related. The financial, if you have somebody who has tax questions or they're struggling, they need some help with making a budget, they can speak to someone for 30 minutes through the financial program and get that help. After that, then they would have to pay them if they're going to stick with that program. If you have people who need resources, let's say somebody wants to move and they need a good mover. Let's say they have a child that has special needs or an elderly person that they're trying to figure out, I don't know what I'm supposed to do. Mom's getting old and I need to know what my options are. This team will help provide you that information. If you need childcare, they're going to get your information and do the actual research for you. They will even call the daycares. They don't always pick up, but they're going to give you information to narrow down your search. And the people who use it really appreciate it. If you're having financial problems, you can contact them and they can tell you what options you might have. The 800 number, 800-624-5544 is great. We have therapists 24 hours a day available to you. If it's in the middle of the night, middle of the morning, you need some support, you need to talk to someone, you can call them. The website is awesome. It's eap.ndbh.com. It has all sorts of assessments on there. If you're wondering, am I having an alcohol problem? Am I depressed? How do I deal with my aging parent? There's all sorts of information on that website, and you can also find the therapist that you want to sign up with. Any other questions? Okay. So I appreciate y'all being here.